Well, as you both know, we have been trying to get public health department records about a mold problem at children's hospitals' operating rooms that has spanned 20 years and killed 6 children. A judge released some documents last month, but he largely granted children's request to keep several pages of records out of the public view. Today, Judge Ken Schubert admitted that he's having second thoughts about his earlier ruling. He made that statement in this hearing this afternoon after King 5's lawyer filed a motion for the judge to reconsider his prior ruling and the harm it could cause by keeping the public in the dark. Children's lawyers have said those records are exempt from public disclosure under a law that protects their quality improvement process, an argument the judge mostly supported in his ruling last month. But since that ruling, Children's held a press conference admitting to 5 additional deaths caused by Aspergillus mold since 2001. That's 6 patient deaths in all. The judge said it's not only that new information that has him reconsidering his ruling, but also 6 pages of additional documents that we have not seen, so we don't know exactly what's in them. However, it's paperwork that Children's admits it should have provided to the court last month.
I accepted, first of all, that these documents, to the extent that they were redacted in their entirety, were part of this quality control committee. Now, I'll tell you, as to that broad view, I'm having second thoughts.
So that is Judge Ken Schubert saying he wants more briefing, more information on these issues. Something in those documents told the judge that maybe these records are not part of the quality control process after all. And this is important because we know that even with the first documents he released last time, which was just a few documents, we learned about those prior Aspergillus infections and deaths, and the hospital held a press conference admitting to them that same day the records were released. So no final decision by the judge today, but we know that he may release more records and give us more insights into what's actually been going on at Children's and what's being done to try to stop this mold that's going through the operating rooms.
So what's next then in this whole case?
Well, he wants some briefings. Everybody's going to take a break for the holidays coming up here. He wants some additional briefing from our lawyers, from Children's lawyers, and then he says he's reevaluating all these documents that he's already looked at once in sort of a new light, and we'll see if that ends up in more documents being released and giving us more answers as to what's been going on at Children's.
Okay.
All right.
Yeah. Chris,
okay.
Thanks.